Record. Okay. Hey, Dwayne. Thanks, guys, for coming. Okay, everybody pull out their study guide. I want you to take notes on it. Okay. I'm going to pull up and share my screen. Okay. And then we'll start going through it. Does anybody have any questions before we get started?
No, ma'am, not at the moment.
Okay, good. Okay. Let me share my screen here.
Oh, he's so cute.
What?
I said they so cute.
Oh, my babies?
Yes.
Those are my babies.
I tell people, you love your kids to death, but
Oh, you love your
that's the whole
you love your grandkids more. Totally.
Yeah, that's a whole different type of
All right. You can read through the first page on your own. It's just all generic information about the exam. Nothing's changed. Okay. So let's start covering the topics. So what do we need to know about sexually transmitted diseases? Okay, there's a couple listed here. Okay, there's HIV, chlamydia, gonorrhea, syphilis, herpes, and HPV. So let's, the one thing I want you to remember about HPV, we talked about this in class, is this right here. Okay, let's say somebody comes to you and says, I recently had unprotected sex and I had a test and it was negative. So that's great. I'm good. What's the problem with that?
It might be too soon.
Exactly. And so what do you tell them?
To get retested.
When?
I guess like in a month or so.
3 months.
3 months.
Okay. A lot of people miss that information. Okay. So just because you had you had recent unprotected sex in the last couple of days or a week and you went and got a test and it's negative, that you have to be able to further that education by telling somebody this could cause, HIV tests, antibody testing can cause false negatives up to 3 months. So you have to repeat it in 3 months. Okay. You guys understand that?
Yes, ma'am.
Okay. What else do we want to know about HIV? I'm just adding in things that are already on your study guide. So that's why I want you to take notes. We know it's a bloodborne infection spread through sexual contact, right?
Yes, ma'am.
It can be spread vertically through breast milk, pregnancy. So what are some high-risk populations? What are some high-risk populations that may be more at risk for HIV?
And the immigrant workers.
Why?
Because first of all, they don't get any, they don't seek any type of medical help for nothing.
Okay.
And then I guess their education, they don't have the type of education that they should for. It's like protecting themselves during sex.
Okay.
I think the homeless.
Homeless. Okay. That's another vulnerable population. Okay. Who else? You're missing an important one.
The adolescent, the teenage pregnancy.
Okay, that's one. That's one. Well, one of the most important vulnerable populations would be homosexual men. Why?
That's a 3-hour drive.
I guess because I don't know.
Like I said, I'm sorry, but our colposcope camera isn't working tonight.
Let me help you here. Homosexual men have anal sex, correct?
Yes.
And so there may be issues with rectal tears or rectal tissue damage.
Oh, yeah.
Right? And
Yes,
so
ma'am.
when you have that and the open sores in that area, what happens?
That's where the infection occurs.
Exactly. Good job. Exactly. Okay, so remember that. Write that down on your notes. Homosexual men are very much at risk for HIV with regards to their anal sex. Okay, the other thing I want you to remember is correctional facilities. So say you have an inmate who comes and is HIV positive, okay, coming into the facility. What are we going to screen for right off the bat? What issues do correctional facilities pose? Close living conditions, communicable infectious diseases.
Yeah.
So what are we going to immediately screen for with an HIV positive patient? Inmate.
TB,
What?
TB.
TB. Absolutely. And I just highlighted that right here. Okay. So important parts to remember. Okay. Chlamydia, gonorrhea. So when we talk about sexually transmitted disease, we talk about viral and bacterial. What's the difference?
Viral, you don't treat, and bacteria, you do.
Bacteria you
If
can treat, right?
Yeah, yeah.
And
That's I think.
viral becomes, there's no cure. It becomes a lifetime of symptom management, right?
Yeah.
Right. Okay, I want to talk about syphilis here. I want to talk about this. If not treated, okay, if not treated with antibiotics in the primary and secondary stages of syphilis, it can become latent and reactivate later in life. Okay, at that point, you can't treat it,
Yeah, it's not curable.
right? If it's not
Yes,
treated in
ma'am.
primary, secondary. If you get asked about what are signs and symptoms that syphilis has moved into the second stage, positive serology will tell you that. Okay. Herpes, genital herpes. Okay. What do we know about genital herpes? Herpes in general. Is it always contagious, or is it just contagious when you have open sores?
The lesions are open.
Always.
Always.
Um,
It's always contagious, right? And it's not limited to the genital area, right? Maybe the blisters may start around the genital areas where the contact occurred, but it will spread. It can spread. Okay. Also, it can be suppressed by antivirals. Remember, it's viral. It's not bacterial. So no antibiotics can be used for a viral infection. We know that, right?
yes.
And we know that it can be passed on to the infant at birth.
Yeah, if you have it
Okay.
through your vaginally.
Yep. Yep. So have a look have a look about that. HPV, what's that?
Human papillomavirus.
Okay. So how do you get it? Having vaginal, anal, oral sex with somebody who has the virus. It's most commonly spread during vaginal or anal sex. Okay. Vaccinations. Okay. Yes, there are vaccinations available. Okay. And here's information about the vaccine. Make sure you understand that the vaccine is safe and effective. It can protect against diseases, but it's not going to prevent all HPV infections, right? It's a good start. Does that make sense?
Yes.
But if a patient says to you, yes, I'm going to get this because it's going to prevent me from getting all kinds of HPV infections. Is that true?
No.
No. Okay. They're safe and effective. They're given during recommended age groups. See who should get vaccinated below. Okay, so it's down here. Okay, so all preteens can be vaccinated. You can actually start at age 9. And then there are HPV tests that can screen for cervical cancer. Okay, those are usually typically done over 30. What I want you to understand about this is how important vaccines are for HPV, but they're not going to prevent every kind of HPV. Okay. Next section, infection control.
Everyone in Boston is so
Okay. What do we want to know about hepatitis? There's 3 kinds of hepatitis: hepatitis A, B, and C. Please know the difference between the 3 of them. When you're talking about infection control, spreading of infectious communicable diseases, what's the best way, the most simplest way to try and reduce the spread?
Hand washing.
Hand washing, proper hygiene. Washing hands, proper hygiene. That is universal. That's why we call it universal precautions. Okay. The other thing we know is that hepatitis can be prevented through immunization. There is a hepatitis vaccine, is there not?
Yes.
And when is that started?
When you're a baby, when you're young.
Right. So this isn't in there, but know that hepatitis can be prevented. Know that there's a hepatitis there's an immunization for hepatitis. Put that in your notes.
Okay, really? Because there's a great deal more that I include on
Tuberculosis. We talked about the correctional facility and the inmate coming in with HIV. The most important thing to screen for is TB. Right? How do we care for a TB patient? Well, first of all, we know it's spread through droplets.
So there'd be isolation.
Wow.
Mm-hmm.
Yeah.
Yep. And caring for them, N95,
Yes.
masks, filter respirators are worn by anybody entering the room. Right? We know that, right?
Yes, ma'am.
That is your baby.
So over the years, with regards to TB, sanitation, nutrition, discovery of antibiotics, development of vaccines has ended some of the epidemics, such as diphtheria, typhoid fever, and incidences of TB. So if you're asked about why has the incidence of TB decreased over the years, here's some reasons: improved sanitation, nutrition, discovery of antibiotics these 4 or 5 things have greatly reduced the incidence of TB. Right?
Yes.
Okay, smallpox. What's the difference between smallpox and chickenpox with regards to location?
It's very much a part of me already. But isn't it going to be a reminder of strength? How he took so much from me?
The difference.
Pox is going to be all over, and smallpox are just going to be on the hand and foot or something like.
No, smallpox is all over too, but smallpox will show up on the palms of your hands and the soles of your feet.
Okay.
Which chickenpox will not.
Yeah.
So here's a summary. Once the sores in the mouth start breaking down, this is with smallpox. A rash appears on the skin, starting on the face and spreading to the arms and the legs, and then the hands and feet and the soles of your feet. So if you're asked about the difference between chickenpox and smallpox, the primary difference is the location on the soles of the feet or the palms of the hands. But smallpox is all over as well, as is chickenpox, but chickenpox won't show up in those two areas. Is smallpox contagious?
Yes.
Absolutely. Okay. First symptoms of smallpox usually include high fever, head and body ache, sometimes vomiting. Right. And once they've been exposed and start to exhibit these symptoms, they get sick very quickly. Sick very quickly. And yes, they are contagious. Okay. But please remember about the difference of where of how to be able to tell the difference between chickenpox. Okay, I want to get into home health. Okay, home health and case management are heavily covered on this exam. So what I want you to realize are a few things. What is home health? Where are we doing the care? Where are we providing the care? Right, in the client's environment. Right? One of the primary objectives for the nurse is to try and facilitate self-care so they can stay in their home. So promoting independence. Yes, they need some assistance, but what is our ultimate goal? The primary objective for the nurse is to facilitate self-care. Right? If we can help clients remain in their home, this allows clients to have some control over their life and can help prevent hopelessness and loss of self-esteem. So we want to encourage them to be as independent as possible. Is that right?
Yes.
What if you go into a client's home and you're doing a safety assessment and you see furniture in the middle of the room? You see area rugs that are moving around when you walk on them. You see a refrigerator that doesn't have the right temperature on it. What kinds of things could you do?
You're going to move the rugs, first of all.
Move them or maybe replace them.
Yeah, replace them with something that's not going to be that's not going to be coming up.
Right, replace them with something that's slippable. Right? What about the furniture?
You're going to move it out the way to the
Yeah.
side so it won't be in their walkway, in their pathway.
Yeah. And then let's say a refrigerator is not working.
You would have to get a new one because they're probably it's not keeping the food properly.
Exactly. So think about when you do a safety assessment, what are the things you're looking for? Okay, you're looking for risks for falling, right? Maybe
Yes.
environmental risks like food spoiling or food contamination by a non-working refrigerator. Another risk for falling is furniture in the way. So you have to be mindful of that. Okay? Slippy rugs, they're going to fall. Encourage them to replace that with non-slipped rugs. Okay, what's one of the first things when we do a home care assessment? Okay, I want you to remember this. To be effective, we've talked about this all term. Doesn't matter what environment we're in. To be effective, the nurse must earn the trust of the family, right? And establish a partnership, right?
Mm-hmm.
I'd like for you to have a look at Medicare. Okay, this bullet describes what Medicare was when it started. Okay, it basically was Medicare program emphasized the care for more of the more acutely ill people rather than health promotion. Okay? And the other thing that Medicare emphasized was communication, the increase in communication. Okay? Documentation, communication. Okay, so the combination of preventative services and illness followed the introduction to Medicare in 66. And so what I want you to know is the Medicare program emphasized on caring for more acutely ill patients, and it focused on increasing communication. In home health, we talk about the Omaha System. Okay? Okay, so this is a system that was developed by the visiting nurses in Omaha. Okay, and it was based on home nursing documentation needs, pulling everything together. Okay, so the three things that are important about the Omaha system, I'm going to highlight this right here, based on nursing documentation needs: organize, sort, and document. So they needed a system that brought all of the home health documentation so that others could see it. Primary cares could see it. Other healthcare providers could see it. So this was developed by the Visiting Nurses Association. Okay, and it was based on home nursing documentation needs. Okay, so the Omaha system is most relevant to home health nursing and is most typically used by home health nurses.
You'll get this free beneficiary link to list important information you want your family to know. Who should you call? How about right now? For free information on coverage that fits your budget, call 1-800-270-5757.
Let's say you're caring for a patient in the home that has right-sided paralysis, maybe secondary to a stroke. Based on what we talked about a few minutes ago, in your care of this client, what are you going to encourage most? Do you want to bring people in to do everything for this client?
You know, you want them to do some of their care, well, as much as their care they can do on themselves.
Right. So helping them participate in their own self-care activities, right? Here's another scenario for a nurse, for a home care nurse. Let's say you go in and you're assessing a bedbound patient. They have a reddened area over the coccyx that does not blanch. What would that be? Stage 1, right? Stage 1 pressure area. What do they need? They need a transparent film that ensures the appropriate amount of moisture is present for healing. Right? No warm compresses. Patient will need to be turned every hour, not every 2 hours, every hour, and monitoring of the area. Does that make sense?
Yes.
That is, so if you have a reddened area that does not blanch, that's considered stage 1. Perfectly okay to cover it with a transparent film. So it can get rid of moisture and you can observe it.
And at the same time, to be able to improve myself, I was like, okay, I'm on board.
Let's go back to home care. Let's say you're working with you're discharging a family of a stroke patient. Same patient. Okay. Because we're trying to encourage self-care activities, that person may not need people around all the time, right? All the time, 100% of the time. Does that make sense?
Mm-hmm.
So a family says, I can't leave them alone. I can't do this. Somebody always has to be with them. What could you say to the family member?
What you say, Ms. Marvel?
let's say you have a family that's so concerned about their loved one who's come home with a stroke, and they're trying their best to do self-care, and we're working with them. What about a family who says, I can't bear to leave him or her alone at all? Somebody has to be here 24/7. Is that true?
No.
No. What would you say? How would you educate the family that it's okay to not be there 24/7 if that's not warranted? What kinds of things might you say to the family?
Well, you let them know that to let them know that the patient can do some things
Right.
for themselves and would be okay, and to instruct them to not try to get up by them, to try to get up or whatever. Just
Exactly.
have everything accessible for them around so they
Right.
so they won't have to get up rather.
Excellent. 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 One of the things that's critical in home care is the sharing of information. Okay, the sharing of information from one healthcare setting or provider to another is critical for community-based care, especially in clients making the transition, any transition, hospital and home, maybe home to the hospital, long-term care facility to rehab facility. Sharing information with regards to home care is critical, right? Okay, let's jump into case management. What is case management? Right? So case manager is the coordinator of care, right? So case management involves activities implemented with individual clients in a system. Case manager may need to explain they're the ones who work with insurance companies, work with doctors, work with equipment companies, work with pharmacies. They're the coordinator of care. So what happens if a case manager may need to explain to two disagreeing parties that come to agreement that might save personal costs for both? Here's an example. So let's say there's a new medication that comes out, but the insurance company won't cover it. Okay, the case manager then says, well, I've looked at the cost of this medication that you don't want to cover, but I've also looked at the cost of hospitalizations if this patient doesn't get the medication. And it's going to be way more expensive for you guys to pay for multiple hospitalizations versus the medication. Does that make sense? That's something a case manager may do with the insurance companies. Right? Collaborating, individual attempts to work with others towards solutions that satisfy the needs of both parties. Cooperation, assertiveness. So this is something the case manager may be asked to do. Right? Case management competency requires that you have the following knowledge and skills. Go through this: knowledge of community resources, financial, written or oral communication, documentation skills, negotiation, conflict resolution skills. So have a look at this. You may be asked, what kinds of competencies do case managers have to have? And you've got a whole list right here. We know that case management can be labor intensive, time consuming, and very costly, right? We typically have been able to case manage lots of patients in the past, but now, because of the increasing number of clients with complex problems, those are the clients we're case managing. Okay, the clients with complex needs, maybe double comorbidities. When we talked about the vulnerable populations, we talked about maybe somebody has a mental health issue plus a substance abuse issue, and they're not able to sort out their resources or doctor's appointments. That would be a specific vulnerable population that we've talked about in our time together with regards to needing a case manager. Okay, some of the roles, the other roles: advocate, care coordinator, referral agent, Okay. A particularly challenging program that can result from healthcare today being given by many different people is the fragmentation of services, right? Which can result in the overuse, underuse, gaps in care, and miscommunication. So this is a particularly important statement as to why we can use case managers. They can be the coordinator of all that. Okay. So you are going to get questions about case management. So please read through this section. Okay. Next, violence and abuse. Okay, this is important. The top risk factor for intimate partner homicide, IPH, is previous domestic violence. Okay. Leading risk factors for suicide are depression and other mental disorders or substance abuse disorders. Other risk factors may include prior suicide attempts, family history of suicide, mental disorder, substance abuse, violence, firearms in the home, incarceration, exposure to the suicidal behavior of others. Right? We know that kids who threaten or harm others or abuse animals are more likely to hurt themselves. People who typically are involved in violence, people who become involved in violence typically had previous exposure to some sort of violence. Maybe abusers were often beaten when they were kids, or they witnessed siblings or one of their parents being beaten. Right? They learned that violence may be a way to manage conflict. And then we have parents that have maybe low social support, have some depression, have multiple stress factors, maybe lost a job, maybe have a history of abuse on their own. Well, they're much more at risk for abusing their own children. Right? And then please down here know the difference between neglect and abuse. There's a difference. Okay, neglect means that their failure to provide adequate food, clothing, shelter, hygiene. Okay, emotional neglect, omission of basic nurturing, acceptance, caring. Where abuse, the actual physical bruising. Okay. So yes, be able to identify a question that may ask about the difference between abuse and neglect. All right. Disaster management. So somebody comes to the ER with a potential chemical exposure. As you ask them to undress and don a gown, what would we use to help them to get rid of their clothes or dispose of the clothes?
Some tongs or something, so you won't touch them.
Yes. Yep. So you need to know about treating a client when they come with a chemical exposure. How would you treat them with regards to protecting yourself? PPE, using tongs. Yes. There's two kinds of disasters, natural or man-made. Please know the difference between those two. That's in this right here. Okay, we have to be able to recognize the impact stage of a disaster. All right. So the impact stage, as nurses delegate to CNAs to remove patients from the accident. So the impact is where it's happened, right? We need to get people to a central place for safety and information. So we can delegate to the CNAs to remove patients from an accident or danger site of a disaster. Please know, as you're educating families about safe drinking water, boiling water, please know this. Boil for 3 to 5 minutes, add a ml of bleach to each gallon, let it stand for 30 minutes. Make sure removing the water from hot water heaters or commode tanks. Here we just talked about this a little bit. If a chemical spill has occurred, use tongs to remove all the clothing. And then here's 3 kinds of agents that are common that we've talked about in this class: vesicant agents, nerve agents, blood agents. Right. So what I want you to know about these is there's an example of each. So blood agent, cyanide. What are the most significant side effects? Skin and respiratory. Nerve agents such as sarin. What is the most critical signs and symptoms they're going to present with? Respiratory. What about mustard gas? Skin and respiratory. Okay. And then for disasters, obviously always follow protocol, ABCs for safety, for all chemical disasters, well, all disasters in general: airway, breathing, circulation. We talked about the difference between smallpox. Okay, hospital-acquired infections. Please, we've kind of talked about this back in the infection control. Remember, N95s for airborne diseases. Private rooms or negative pressure rooms if it's an airborne disease, say like TB. And I want you to review this. What are contact precautions in the home? Okay, contact precautions that require the use of gloves to prevent contact with wound secretions during dressing changes. Soil dressings should be disposed in a securely tied plastic bag. Okay. Cultural considerations of religious influence. Okay, so we know that culture and religion influence lifestyle choices. Okay. For purposes of this class, here's what they affect or can affect. Their considerations with regards to smoking, drug use, nutrition, caffeine, reading materials. So what I'm getting at is different cultures are influenced by all of these here. Okay, with regards to food, there are only certain butchered meats that are tolerable or acceptable to the Muslims and the Jewish cultures. Okay, so what I want you to know from here is these are some of the influences of certain cultures. They may all have different views on smoking, different views on drug abuse, food preparation. Okay, and then the last section is scope of practice for the LPN. Okay, nursing assistants, we cannot assign CNAs to patients who are unstable, correct? You guys know that, right? Yes. Okay. When we are delegating to the nurse assistant, we must give specific instructions as to what is to be done. Okay, that's one. We must instruct how it is to be done. We must give information that needs to be reported. Okay, because we are responsible for the outcome of delegated care. So here's the 3 things you need to, when you delegate: specific instructions about what's to be done, how to get it done, and what needs to be reported and documented. Okay. So don't just go through what I've highlighted. I've highlighted the important parts of this. Okay, you're responsible for the whole study guide. If there's sections that you don't understand, like you don't understand cultural considerations, go back to the culture chapter and the culture readings in your assigned readings for the week. Okay, if you don't understand or need some more information on sexually transmitted diseases. Go back to that section of your reading. Okay. Can you guys turn your cameras on for a minute? Where'd Dwayne go? He leave? So that's a quick rundown of the study guide. I have a recording for it. Does that help?
Yes, ma'am.
That should
Yes,
help a
ma'am.
lot. That should help a lot. Okay, you have a good understanding of the study guide. You're going to be in the 90s on the exam.
Uh-huh.
And I know all of you want that.
Yes.
So please encourage your teammates to review this recording.
Okay.
I'm going to send it out today or whenever it gets converted. I'll send it out. But yeah, again, use the study guide as your primary resource, and then reach back out to your readings and your assignments and your lectures if you're not understanding. And if you really are not understanding, please schedule a Zoom with me next week before your exam, and we can go over whatever you don't understand.
Okay.
Don't overdo it. Don't overthink it. Okay?
Okay.
Do you guys have any questions? I hope this has been helpful.
It has.
Yes, ma'am.
Sheik is going, yes, it has.
Yes, it has.
All right, I gotta run since I have to do an exam. I'll see you guys. When do I see you guys? Today?
Friday.
Monday.
Friday.
Are you all Friday? Okay, all right.
No, on Monday.
Well, I'm
Oh,
Friday.
yes, I've already seen you. Where'd Dwayne go? He was here. He left. All right. All right, you guys. Thanks for coming. I appreciate it.
You're welcome. Have a great day.
Hey, you too. Okay, bye.
Bye-bye.
Bye.